there, I'm Dr. Hillary Hushower from Rangeline Chiropractic. Hope to see some of you watching and learning a little bit about leaky gut syndrome. So I've been asked about it, and it's kind of a topic that's been thrown around a little bit more lately. If you've heard about it in the news or a friend has mentioned it or you've read something, leaky gut syndrome. So I took some notes, I did some research for you, and I'm going to kind of talk about today, like kind of what is it, a little bit introduction to it, and like some symptoms of leaky gut syndrome. And then in another session, I think we'll talk about problems that arise. And then I also want to talk about ways to heal the gut. So currently, I thought to myself, I could have leaky gut syndrome. And I researched some of it and I thought, yeah, some of those symptoms sound familiar. Some of this could be me. And so I am currently on a leaky gut support protocol. And so as anything I do in the office, I like to do it first and then report back to you. So I'm on about day 6 of a 41-day protocol, and I feel great, just so you know. And I'm going to talk more about that in the future. But leaky gut syndrome. So a lot of times you'll see that, and it's also abbreviated LGS, leaky gut syndrome. It was first started, I think, I don't know, 20 years ago. But some doctor was thinking like, hey, there's more to these symptoms that people are having. And I found in one of the articles I read that 90% of our health problems and diseases start with an origin in the gut. Like, how crazy is that? How often do you think about that? Hey, I think there might be some problem in my gut and some microbiome is disrupted. Like, no one ever thinks about that. But as I was reading more about chronic diseases like arthritis, diabetes, depression, things like that, they're showing more and more of that relating to our guts and our intestines. So everything they're saying, not everything, but a lot of the articles are saying that things can be traced back to inflammation in our gut. So things like constipation, aches and pains. And if you think about our gut as taking in our nutrients, and when it gets damaged, toxins are released out. So they also call like our GI tract, our gastrointestinal tract, as like an engine room, and it takes the nutrients that we eat and it utilizes it, right, and delivers it to the cells, and that's how our bodies use it. So obviously we know we eat so we can sustain life, but there's like 30 feet of our digestive tract. And can you think about like 30 feet of that all in your abdomen area? It's just crazy. I think that the body is just so amazing to me. So when there is an imbalance in that, as you can see, can lead to like a whole host of problems, because if everything's down here and 90% of our ailments contribute to this, then, I mean, there's a lot left to be looked at. So exactly, like, what is leaky gut syndrome? So it's also called increased intestinal permeability. Exciting, huh? So it's gaps in the walls of your intestines. So I think of it visually as like a strainer, where things are going in and trickling through the strainer, whereas it shouldn't be straining out anything. It's like a colander that we would use in our kitchen. And so substances like bacteria and toxin, and even like some of our digested food, are getting through the wall, the lining, and it's going into our bloodstream. So that's not supposed to be in our bloodstream. So then we're going to have inflammation because of that. So when we have this intestinal permeability or leaky gut syndrome, it's going to lead to more like chronic and autoimmune diseases, and like type 1 diabetes, celiac disease, Crohn's. So I feel like that's really on the rise lately. And I think that everyone hears more and more about that in the news, and maybe you're diagnosed with it or you know someone that is. I hear about it quite often for patients that come in and they're like, oh, by the way, I was diagnosed with this, this, and this. And I think, I wish you would have told me about that. There's probably something I could have done to help. But we don't really talk about our bowel movements that much, do we? We kind of hush over that. But it's important that we have correct bowel movements and we eat correctly. And so it's an important topic to talk about. especially with kids. Make sure you're talking about it with your kids. So like I said, when things are passing through the intestinal walls and they're getting into our bloodstream, we're going to have inflammation and changes in the, you've heard of like your gut flora or the bacteria that's in there, how it should be good bacteria. When we don't have the correct bacteria and we have more bad bacteria, that's the problem. So we want the good bacteria to eat the bad bacteria, right? And we want to have more good bacteria than bad bacteria. And when it's disrupted like that and the balances are off, then you're going to have more inflammation, more problems. You're not going to be digesting food. So some things to think about. So the digestive tract is made up of the stomach, the esophagus, and then the small and the large intestines. So when we're talking about the GI or digestive tract, that's what we're talking about, all of that. So in the stomach, the enzymes break down the food into small pieces to be used for energy. And then we've got the bloodstream and the intestines. So I think that you'll hear more and more about this years to come. And the more that we talk about it and get information and do research, the more information we'll have. So a lot of things I read were like saying, well, it could be this, or it is thought to be this. So just so you know, a lot of things I read and I'm going to present to you isn't 100% accurate. So they're still doing so much research. Don't take everything 100%. Take everything with a grain of salt and like learn more about it. And I hope that you learned some information today, and then you can do some more research and we can chat again about it. Like I said, the leaky gut syndrome, think of it like a bucket with holes that shouldn't have holes in it. And so we're continually leaking out, quote, water from the bucket, and it shouldn't be. And so that's getting into our bloodstream. So the first like issue with the leaky gut syndrome was it was 1930s when a doctor saw some correlation between symptoms and inflammation and autoimmune. And I thought that was interesting, 1930s back then. But I find like it's been in the past like decade that I've heard more about it. And I feel like in the next decade, it's going to be quite more prevalent than you're thinking. So the most common symptom that I learned about for leaky gut syndrome is constipation. So I think we all know what that is, but it's the hard, drier bowel movements, and it's classified less than 3 times a week. So it wasn't limited to a particular person or age group, but that's just generally like what is one of the symptoms of leaky gut syndrome. So another symptom was irritable bowel syndrome, IBS. I think that we hear a lot about that on commercials and people holding their stomach and talking about IBS. So IBS is discomfort and bloating, and it can be with constipation or not constipation or both or neither. So it's just telling you like, hey, there's something wrong. Like you shouldn't be constipated all the time. You shouldn't have diarrhea all the time. So when you see that symptom, a light should go off that, hey, I think I'm having a problem. Like your body would function normally if everything was correct. And if it's not functioning normally, that's because something's not correct. It's like telling you something without words. Your body's telling you you have a problem. So the types of IBS, there's one called IBS-C, and the C is for constipation, the IBS-D for diarrhea, the IBS-M is for mixed, and the IBS-U is for like subtyped, unclassified as to what it was. So you'll hear a lot about IBS things with leaky gut syndrome. And then what I read is that there's a theory that IBS is out there and occurs because the muscles are on the bowel, like they can't squeeze normally. So that was one thing I found interesting in one of the articles I read. Someone also suggested that it could be to chemicals in our body like serotonin and gastrin that control like nerve signals, and that could be a cause for IBS. Again, these are like could be theories, nothing set in stone. And again, I feel like IBS hasn't been around for that I have heard of for like no more than 10 years. And I think you'll keep hearing more and more about IBS. I also found that it occurs more in women than in men. And they also are postulating, like, could it be because of hormonal imbalances? So we'll see with the years to come, like what we learn about that. Another symptom with leaky gut syndrome is overgrowth. It's called small intestine bacterial overgrowth. And so, like I said, we should have bacteria, and a lot of times we have too much of the wrong bacteria, or it's supposed to be a balance. I think everything in life in our body is a balance, and when it's off balance, that's when our body has an issue. So the overgrowth, you would see chronic diarrhea and malabsorption. So malabsorption meaning you're eating, but you're not getting all the nutrients from that food. And that can also be seen in blood work. So if you get your blood work taken and your doctor tells you that you're not absorbing things well and your levels are off, and you think, I eat really healthy and I do this and that. Yeah, you can eat healthy, but if you don't absorb it, that's the problem. So it doesn't matter how much you eat if you're not taking it in and you're just excreting it. So let's see, symptoms for small intestine bacterial overgrowth would be like chronic diarrhea, weight loss, and malabsorption. Another thing is food sensitivities. That's a symptom in leaky gut syndrome. So I wanted to go into the differences of like food sensitivity, food allergy, food intolerance, because I think a lot of that gets thrown around together. So a food sensitivity is something that is delayed and is not life-threatening. So they go undiagnosed because it takes a while for the symptom of the sensitivity to set in. So just because you would eat something today, you might not have that reaction until 4 days afterwards, and then you wouldn't remember what you ate unless you did a food journal. And so that's why a lot of people do food journals. It helps. So a food sensitivity, let's talk about the 3 different types of sensitivity, allergy, and intolerances. So with the sensitivity, like I said, that's going to be delayed for days. And then a lot of people don't know they have it because of that reaction time, and it mirrors other type of ailments. So the sensitivity is a specific antibody that they would test for. And now a food allergy is going to trigger a histamine reaction. So when you're thinking an allergy, you're thinking of the people with like peanut allergies that have like an EpiPen, or like a shellfish allergy that is going to have like a severe symptom, or like an anaphylactic shock, or they get hives on them. That would be more of an allergy. And then an intolerance, food intolerance, would be something where you lacked an enzyme. So I feel like the most common intolerance that we all know about is milk intolerance, dairy, because that person would lack lactase enzyme to dissolve that. And also, in case you didn't notice or know, that food intolerances are very common in family members. So the mom or dad would also have the same as their parent, and then also the child could have it too. So when you're looking at milk intolerances and your mom has that, and chances are you have it and your child has it, just something to be aware of. I find that interesting. So the main thing with the allergy, sensitivity, intolerance is how your body reacts to it, and then the different kind of sensitivities with the immunoglobulins, and these things can be tested for. So you can find out if you have like an allergy, an intolerance, a sensitivity, and then know how your body's going to respond. So sensitivities show up a few days after eating something, and then traditionally you would do like an elimination diet, removing like one culprit at a time. But elimination diets take weeks, so you don't eliminate for a day and go, oh, it wasn't the dairy, I can be fine. Like, you would do this over like 2 to 8 week time frame. So what I tell patients is to pick one thing to remove, so and one of the most common ones would be dairy. So if you're having some issues with constipation, diarrhea, just overall general not feeling well, fatigue, malabsorption, you can usually start with dairy. That's a huge culprit for people. You would just write down what you ate and then how you felt afterwards every day. Sometimes I write the next day how I felt when I woke up, so I could see how I felt like that night prior to. And that's what I'm doing right now, just going off of how I feel with my foods that I'm eating. And then after a couple weeks, maybe bring that back into your diet and see how you feel. You still feel fine? Great. Let's try wheat or gluten next. So there's different things that you can try. I think you'll know if it's more intense with like hives and anaphylaxis. And so most people know if they have a peanut allergy or not, but trying other things. And it might be something as simple as like strawberries or bananas. So kind of start with the most common sensitivities and then work your way down the list would be the correct way to do an elimination diet. And there's lots of information online, but if you have any question, I can help you too. Another problem with leaky gut syndrome, peptic ulcers. So I wanted to look up and find some information about peptic ulcers versus gastric ulcers. So I think that people just generalize ulcers, and I found some interesting information. So peptic ulcers are a symptom that accompanies like the leaky gut syndrome. And usually it's predominant in the older population, 55 to 65. Although these days I really don't feel like that's old. So, but anyways, and then men get more duodenal ulcers, and then women get more gastric ulcers. So it depends on the location. I found that interesting. Women with the peptic ulcers have like the upper stomach problems due to like the gastric acid. They have like just mild symptoms, okay? And they might have some bleeding. As far as like when it's pain that radiates from the stomach to the back, then that's like a sign that an ulcer has like penetrated. That's more severe. If pain radiates from the stomach to like the upper right side, we call that the upper quadrant, then we're thinking more like gallbladder issue. So, talking to your doctor depending on where it radiates to rule out what it is. Peptic ulcer is more like burning or gnawing. And acids give it relief as opposed to gastric ulcers, which are the most common, are more aggravated with meals. So duodenal ulcers, like that's one with the men, are relieved by meals. I found that interesting. So them eating makes them feel better. So gastric ulcers, patients avoid food and present with more weight loss, but duodenal ulcers do not lose weight. So interesting about the ulcers and, peptic versus gastric. I found that interesting. I didn't know a ton about that. So our next chat, I want to talk more about some more things that go along with leaky gut syndrome and really like dive into like, okay, yeah, this sounds like something I could have. Yeah, it sounds like I've been dealing with this. What can I do? Currently, I was telling you I was on a protocol for a leaky gut syndrome. It's just a support protocol. It's 41 days. Eventually, as long as everything goes well with my support protocol, I would love to offer that to patients or anyone out there listening. And currently right now I'm eliminating food that are known to be aggravating. So we're thinking more like anti-inflammatory foods are what I'm eating, and none of the fun dairy and sugar. Definitely sugar has to be cut out. And I feel like after the holidays, I think we all should just cut out the sugar. So that would also be a good start. Anyone listening, like if you needed a jump into changing a habit, why don't you just cut out the sugar? Just start with that. And then we can talk about eliminating food. And then eventually what I've done is I've incorporated some different supplements to help me kill off any bad bacteria and bad parasites. And then my next phase, I'm actually going to be doing protocol to heal the gut. So if we kill off the bad stuff, then we want to heal and nourish, and then know what foods I can and can't eat, and then watch the symptoms. So if you want some action steps after this, stop the sugar, start food journaling, write down what you ate and how you felt maybe right after it, but then also the next day. And then I've also incorporated, I also weigh myself in the morning and to see how it fluctuates with the different foods too, because when you eat foods you shouldn't, you kind of bloat up a little bit more and retain more water. So see how you do. So No sugar, do a food elimination journal diets, and also drink a lot of water. I feel like everyone's dehydrated, and everyone tells me they drink a lot of water until I ask them, well, how many ounces? Um, Studies show you should drink about half your water weight, excuse me, half your body weight in water. If you can't do that, then just do something close to it. I know it's hard at first, and for me to drink 100 ounces of water, at first I was like, oh my gosh, there's no way I can do this. But now I do it quite often without any thought process. But I always try to think during the day, like, all right, that was 30 ounces, 20 ounces, and go from there. So hope this helped. Feel free to reach out to me with any questions you have, and I'll present some more information soon.